Jai Hind everyone, welcome to my YouTube channel, Vetarmy. I'm Assistant Commandant Dr. Deepak Sharma. So recently in Feb 2023, BSF had posted up recruitment advertisement of around 35 posts for the post of Assistant Commandant Vet. And last week, around 20th May 2023, SSB, that is Sashastra Seema Bal, has also put up an advertisement of 18 posts for the post of Assistant Commandant Vet. So back in 2019, I had also applied for the post of Assistant Commandant Vet in ITBP, and at that point of time, I had no clue what this post is about and how this exam is, like what is the pattern of the exam. So in order to prepare well for the exam, I tried to search it on Google, YouTube, like Quora, and tried to like know it from my seniors, but I couldn't get any information about this. So eventually, the ultimate guidance for me at that point of time was that notification itself. Okay, so in this video, I, Assistant Commandant Vet, would like to share my experience and my insight about these exams, which hopefully can help you guys understanding more about these exams. So let's start with a brief intro. I am Dr. Deepak Sharma. I'm a veterinary doctor. I did my graduation from Bombay Veterinary College, Mumbai, 2013 to 18 batch. Then I did my post graduation from Guru Angad Dev Veterinary and Animal Sciences University in veterinary gynecology and obstetrics, and currently I am working as an assistant commandant in ITBP. So crack ITBP, BSF, SSB, CAPF assistant commandant vet. So what is CAPF? CAPF stands for the Central Armed Police Forces. So it consists of six forces, that is Indo-Tibetan Border Police, ITBP, Sashastra Seema Bal, SSB, Border Security Forces, BSF, Central Industrial Security Forces, CISF, Central Reserve Police Forces, CRPF, and Assam Rifles. So these forces are given the responsibility of internal security and border guarding forces. You can read more about these forces and CAPF from Wikipedia or the government website. So veterinarians and CAPF. Currently, ITBP, SSB, and BSF. Out of six forces, these three forces have the permanent post of assistant commandant vet. What do I mean by permanent posts? So once you have cleared this exam, unlike you get the retirement at the age of 58 to 60, unlike RVC, where you are like most of them have to leave the service after 8 years of the service. Okay. For those who do not know more, who do not know anything about the post assistant commandant, just to make you understand better, an analogy is assistant commandant is a rank which is equivalent to the DSP rank in state police forces and captain in Indian Army. Basically, you get 3 stars on your shoulder. So, what are we veterinarians are expected to do in this job? The primary job is to take care of the livestock, equines, and dog squad of the respective forces, and the secondary job is to perform all the duties they are expecting from their officers to do. Okay, which is a very big topic again. I can tell you later what are the other duties an officer also do in battalion in the forces. So what are the perks? The this topic again is itself is a very big topic, but in nutshell, uh, it's a grade one government central government job which ensure your job security. The second is the pay scale level 10, that is 56,100, which is the highest pay scale you can get in India after graduation in government job. Okay, and when I say pay scale 56,100, that doesn't mean you get the salary 56,1,000. 56,000 is your basic pay. On your basic pay, you get your DA, you get your TA, you get your NPA. There are multiple n number of allowances are there, so that adds up to your salary, and your salary actually is more than 56, like it's up to around like 70, 80. Okay, then yeah, the third one is like you directly become a gazetted officer, which is a proud thing for your own self. Okay, and all the perks of being an officer in CAPF. Okay, what are the perks? Again, I've told you, like, let me know in the comment section if you guys want to know more about the perks. I will make another video on it. Okay, so let's go to the next slide. Eligibility. So first comes the age. So your age should be more than 23 years and less than 35 years at the time when you are applying for this job. Okay, you can get age relaxation if you belong to the SC, ST, OBC, or ex-serviceman category, or you're from like Jammu and Kashmir state also. So that you can, like, that idea you can get from the notification itself. Okay, you have to fill an appendix, and you know, like, represent a performer in front of them, and okay, you're good to go. Then comes the qualification. The qualification is basic, the bachelor's in veterinary sciences, that is BVSC. Then, very important, VCR registration. They do not acknowledge your state veterinary certification. They only acknowledge VCR registration. That's it. That is, you have to get it from Delhi. Okay. Then comes the stages of exam. So stages, like, there are total 5 stages of exam. So all the forces in CAPF, be it ITBP, SSB, BSF, be it any of these forces, the pattern of the exam is more or less the same. Okay, so it consists of 5 stages. First is documentation, then comes the physical exam, then comes the written exam, then comes the interview, and then comes the medical test. So once you have cleared your documentation, that is, they will ask you for your 10th class mark sheet, 12th class mark sheet, then comes your graduation transcript, passing certificate, and your VCR registration, which I've already told you about. Then comes, once you have represented all your documentation, then comes the physical exam. In physical exam is consists of 2 stages, that is PET and PST. PET full form is physical evaluation test. So basically, they test your physical capabilities. How? So it consists of 4 sub stages. First is 100-meter sprint, which you have to finish within 16 seconds for male and 18 seconds for female, which I do not think any problem for anyone, specifically for people who are well, like, moderately active in their graduation. Then comes the 800-meter race, which in my experience people are a little scared about. I am assuring you, do this thing. If you are scared that you will not be able to finish 800-meter race within 3 minutes 45 seconds, what is supposed to do for 20 days, 15 days to 25 days before this exam, basically 1 month prior to this PET, just run 1 kilometer every day and time yourself. That's it. That is all you need to do. Just run 1 kilometer a day and try to time yourself, try to improve your time. You will see that on the day of PET, you will excel it. You will finish it within 3 minutes 30 seconds also. For female, 4 minutes 45 seconds, it's way too much time. So trust me, I can assure you the thing I'm telling you, just run 20 to 25 days prior to this PET, just run 1 kilometer only, and you will be excelling in on the day of PET. Then comes the long jump, which is another critical part of this test where most of the people get failed. Long jump, that is 3.5 meter for the male candidates and 3 meters for the female candidates. Again, this is a thing, like, this is a practice. This is a stage which you can clear by practicing. Okay. Then comes the shot put, where you have to throw a ball, metal ball, weighing 7.26 kgs across 11 feet, 12 feet. So I think like 11, 12 feet is their maximum standard. So I think that's not a big issue for any of the like, for male candidates. Okay. Then comes the PST, physical standard test. Your height should be more than 165 centimeter in case of male candidates and 150 centimeters in case of female candidates. Your weight should be as per your body mass index, BMI, that you can calculate on Google. For male candidates, the chest should be at least 81 centimeters and expansion should be at least 5 centimeter, which again I don't think is a big issue. You can get more details about the PST from Home Ministry website or these respective CAPF, like all the forces website or Indian Army website. Okay. Then comes the written exam, which is another havoc for the candidates, that what kind of question could be asked in the exam. I can assure you the level of the questions in the exam is not difficult. Okay. So let me tell you this one thing. There is no standard SOP written that so and so level, so and so pattern exam has to happen. Okay. So the exam pattern is not decided. It can happen like the maximum marks of a question paper can be 50 marks, 100 marks, 200 marks, 300 marks. It can be anything. Okay. There is no standard SOP. So the veterinarians in the forces, they only decide like what will be the pattern and what will be the maximum marks. Okay. So mostly the pattern of the question paper is MCQ based only. But when I had given my ITBP exam, that time 50% questions or 50% marks were for objective and 50% marks were for theory uh, paper. Okay. The questions will be of BBSC and AH level, that I can assure you, like not like net level exam or the questions you have like faced for your PG entrance exams. No, the PG entrance exam level is a little difficult than this paper. Okay, I can assure you that. All you need to do is have a general idea of all the subjects which you have studied in your BBSC. When I'm saying all the subjects, I mean all three clinical subjects, that is medicine, surgery, and gynecology. Then in non-clinical subject, LPM and nutrition, and in paraclinical subjects, micro, pharmacology, and pathology. Just have a general idea of all like these subjects which I have just quoted, and you're good to go. Actually, way good to go. Okay. So, and obviously, like more focus on clinical subjects. Interview. So once you have cleared your physical test, once you have cleared your written test on your recruitment website, on your personal ID, you will get your admit card for your interview, and they will call you for the interview in Delhi on UPSC CAPF headquarters. Okay. Yes, you heard it right. Your interview will happen in CAPF headquarters. The interview panel uh, is consist of almost 8 to 9 people, and out of 8 to 9 people, 2 to 3 like people will be from veterinary background. Rest of them will be from the general background. Okay, they will be officers of the rank DG, ADG, IG. They could be anyone, any rank, and they could be from any forces also. But out of like let's say 9 people, 5 to 6 people will be from the same force, like like for which you are giving your interview for. Okay, other forces officers are also there, but you cannot like identify them because all of them will be sitting in the civil uniform. What are the types of question? The types of question, the range of the question is very wide. They started from like your general aptitude, like where are you from, what is your name, the meaning of your name, any specific like any specific quality from like your hometown, anything famous from your hometown, the place of your like graduation, post graduation, comparison between two places, like why did you like like the place of your graduation, basically like just to know like if you have a general idea of your surrounding. Okay. Then the veterinary related questions, yes, the people who are sitting in the panel from veterinary background, they will be asking you questions. Mostly it is related to clinical subjects only, like dose rates, anesthesia dose rates, uh, maybe like the antibiotics dose rate. They can ask you like like they can present you a case, like if a dog case has come to you after a case of accident, and on physical examination you find like let's say crepitation on the neck, like what do you suggest, like how, like what do you diagnose? So obviously it's a case of like subcutaneous emphysema. So what will be the course of treatment in that case? So questions like this could be asked. Then like about your hobbies and all. Then comes like once you have cleared your physical test, your written test, and your interview test, then on website like they will send a list of roll numbers will be which will be called for the medical test. Okay, so medical test is not the indication that you have like you're selected. They always call more people than the recruitment post. Okay, so don't get overconfident. It's a part of the test, like you're still under the test only. So what they basically majorly focus, so they mainly focus on blood parameters. So medical test basically have like gets over in 2 to 3 days. So on first day, just pass like in filling the forms only, just doing the formalities, and like they make you fill like n number of forms, like 30, 30, 40, 40 pages ka forms. So it takes like 2 to 3 hours. Then that day itself, like they take a blood sample which they send for the like blood, the normal blood parameters, your urine sample for urine analysis. Then the like there is a surgeon in the board who checks for any kind of physical deformity or like unfitness according to army standards, which can be knock knees, like angled elbow, or like the cryptorchidism. Like these three things are like the permanent and unfit category. Like uh, it's not claiming that you are unfit, but according to armed forces, yeah, you do not medically fit. Like categorized fit in according to the armed force category. Then your eyesight should be 6 by 6. Yes. Do not get anxious if you have specs. Even I have specs and my power is and when I had given my medical test, that time my power was like 1.5, I guess, minus 1.5. Even if you have a power around 2 or more than 2, do not worry about it. Your eyesight should be 6 by 6 in like with or without specs. Okay, so just make sure like the day of the medical test you use your specs which you normally use basically. Then comes the color blindness, which like you can also check yourself. Go to the Google, like, and it will show you certain pictures. Basically you have to uh, identify the difference between like green, red, orange, and blue. Like I think this is the that's it. You can check yourself on Google, and more details you can get from uh, the Indian Army website or CAPF website or uh, Home Ministry website. I'll put up the link under this video, so you can go and visit that website, and you can get to know more about like the medical standards of these tests. So yeah, that's it for today. Let me know in the comment section if you want me to make more videos about any topic, be it perks, be it the salary, be it the medical standard, be it like the kind of questions. If you want me to give you more examples of the kind of questions they ask in the written test or the interview, so yeah, let me know in the comment section. I'll be making the videos, or I'll reply you in the comment section. So please like and subscribe my channel. Thank you. Jai Hind.